I'm about to tell you all the truth about dental implants your dentist or your dental clinic will never tell you, but I will. I'm Mr. Transformation and I have more than 10 years of experience in dental and medical tourism, and I have seen more than 10,000 implant cases. And let's break down
Let's
every
reveal
single
all the
detail.
secrets.
Let's go. Yes, dental implants are one of the most life-changing dental treatments in modern dentistry, but still, they're one of
The most misunderstood treatments too, because the clinics or dentists only talk about success stories, but the reality is different.
What exactly is a dental implant? A dental implant is not the new teeth. A dental implant is an artificial root, generally made of zirconia or titanium. And also, a dental implant consists of three parts. First one is the screw, which your dentist will screw into your jawbone, and it's not gonna be seen. And the visible tooth here is called crown, and there is an abutment. It acts like a connector between crown and the implant. But what's important here is you're not getting all of these at the same time. When you have the screw in, there is a healing time which is minimum 3 months, and in some cases it can reach up to 6 months. Disadvantages nobody talks about. Yes, implants are amazing, but they're not perfect. 99% you're gonna experience these three: pain, swelling, and bruising. It's done under local anesthesia, so during the surgery, it's very hard that you feel any pain. But I'm talking this about when you're having all the surgery with an authorized or experienced implantologist like oral and maxillofacial surgeon or periodontologist or an implantologist. Both can do the implantology surgeries. But after the surgery, to 2-3 days, you'll feel pain. But this pain, it's manageable pain. Swelling can last 3 to 7 days, and some patients might not have swelling, but most probably you will have even small swelling, and it doesn't have to be severe swelling like an Alvin. But after a week, if you're still experiencing excessive or severe swelling, you should contact with your dentist. And some patients will experience bruising and around the eye or chin. That's very common, but you may not also experience this, but most probably one place or all over, depending on how aggressively you are getting implants. Even one or full mouth implants, you can experience bruising, and this bruising will go away within the week. And also chewing around the surgical implant area will be uncomfortable when you're chewing. Of course, your dentist will tell you not to chew on the implant site, but if you're having a full mouth implants, you won't be able to chew anyway. Another disadvantage of getting dental implants is multiple surgeries may be required, such as sinus liftings, bone grafting, or gum grafting, or implant revision, or implant extraction and reimplantation. All of these can happen in certain circumstances. If your implant fails, or if you don't have any bone area, you may need a bone graft, or if it's near your sinus area, and your dentist may call it a sinus lifting and do a sinus lifting surgery before you get dental implants. Third, and the most important disadvantage of getting a dental implant is being toothless during healing time. This healing time lasts minimum 3 months, and it can reach up to 6 months in some cases, and in some cases it can reach more than a year, because when you need multiple surgeries such as sinus lifting or bone grafting, this may add extra time to your being toothless time. During this time, you have generally 3 options: being toothless, and your dentist will tell you don't chew on that side. And the second option, and you may wear a removable denture or partial denture. And third option is having a temporary bridge, which is during the implant surgery, your dentist will place a healing cap and another dentist will place a temporary fixed denture on it so that you can use your teeth during the healing time. But it all depends on your personal situation and your bone density or your implant surgeon's decisions, okay? So you have to be prepared for all the three options. You can be toothless, you can wear removable dentures, you can have a fixed temporary. The fourth disadvantage of a dental implant is they're not permanent. Forget what your dentist or what you read on Google. Lifespan of a dental implant is average 10 to 20 years. In some cases, it can be more or less. For example, if you do a very good dental hygiene, it can last longer. But if you're a smoker, if you have a diabetes, or if you have gum disease, it's gonna be shorter than this. The fifth disadvantage of getting dental implant is a risk of peri-implantitis. A gum infection can destroy your bone and it will cause implant failure. When an implant fails to osseointegrate, failure rate is 3 to 10% depending on your health and depending on the clinic or dentist experience. And what are the reasons that can cause implant failure is smoking, low bone quality, inexperienced dentists, it's the poor surgical technique, uncontrolled diabetes, and instant loading when the bone is not ready, cheap implants, and infection. What are the steps generally after dental implant failure is first to take out the implant, extract the implant, clean the area, and wait for 2 to 4 months to heal. And after that, if it's needed, your dentist will perform a bone grafting to create a bone tissue there. This means more cost, more surgery, more time. Now the good news about dental implants. Sorry. Dental implants protect your jawbone. When you have lost a single or multiple teeth, your bone density is getting lower and lower and day by day. But when you have dental implants, it's gonna preserve your body, will preserve the bone density or bone situation in that area. And dental implants stimulate the bone like real roots, but dentures not. Generally, dentures put another pressure on your missing tooth area and your bone gets lower and lower. Unlike the crowns or bridges, dental implants will not affect your neighboring tooth. So like in this case, if you're having a dental implant, you can replace a single tooth, a single missing tooth. But if you don't have implants and you have to use these 3 teeth to make a bridge. Dental implants look and function like real teeth. You can eat with them like your original tooth. You can chew with them like your original tooth. An absolute contraindications list, which means if you have these, you cannot have dental implants. If you have allergy to titanium, you cannot have dental implants. Yes, it's very, very rare, but rare, but it's real. If you have active chemotherapy or radiotherapy, you cannot have dental implants. If you have uncontrolled diabetes, you cannot have dental implants. And if you have active bone infections, you cannot have dental implants. If you have severe bruxism, which is night grinding, without protection, you cannot have dental implants because you're gonna hurt and you're gonna cause a failure of dental implant. If you have an active gum disease, most probably you won't be able to get dental implants. And if you have extreme bone loss, you cannot get dental implants unless you get bone grafting, or in some cases for upper jaw, you can only have like cheekbone zygomatic implants. when the dentist placed the implant to your zygomatic bone. Relative contraindications. In these situations, you can get implants, but you need to get the approval by the doctor. Controlled diabetes, and your implantologist will ask you what are your, the blood sugar levels, and he's gonna evaluate them before placing a dental implant. In any of the heart diseases, you may need your dentist and cardiologist opinion. And if you are using blood thinners, that's also another thing that you need to get opinion of your dentist. Osteoporosis, if you have osteoporosis, you need to get a doctor approval too, because the medications that you are using can cause different problems. Here is the real implant timeline, not the marketing version. From day 1st to day 7th, you may feel tenderness, pain, swelling, bruising. And the first 24 hours generally, but what your dentist will advise is to do cold compress to the implant area. And your chewing will be limited for 7 days. And you will be able to feed yourself with soft food only, depending on which area you had the implants. In some cases, soft food only will continue till you get your final teeth, which is 3 to 6 months. Second week, discomfort most probably will be gone. But if you're still having pain or swelling, it's increasing, not decreasing, you have to contact with your dentist, because it can indicate that there is a problem with the implant. And also the second week, stitches will be removed already, and you will have your temporary teeth, if needed, as fixed. 3 to 6 months, your implant is healing, and after osseointegration, the bone and the implant integration finished, you will come for the second visit, which is the final placement of your crown and abutment. And when you arrive, your X-rays will be taken, and your dentist will check, as implantologist will check the implant situation, and a prosthodontist or a cosmetic dentist will place the abutment and the crown. And also it can take 5 days to 3 months, depending on where or which clinic you are having this treatment. So should you get implants or not? Is it worth to invest or not? Actually, yes, implants are worth it if you want a permanent solution for your missing tooth or a fully missing teeth. They are worth to invest, because it's gonna change your life. You have to find a good clinic or a dentist experienced in implantology. And if you have enough bone, and if you are going to follow aftercare instructions, which means to continue a good dental hygiene. This question has 2 answers. So the second one is no. If your bone is too thin and a bone grafting is not an option, and a zygomatic dental implant is not an option, don't get dental implants. If you're not gonna do a good dental hygiene, don't do dental implants. Final advice: choose your dentist and dental clinic like you're choosing a pilot. Experience bigger than price. Technology is bigger than marketing, and good aftercare means more than everything.